Welcome, Pierre. Thank you so much for joining us today.
Thanks. Happy to be here.
So the way that I'm going to do this is I'm going to ask Pierre some questions and she's going to answer them. And if any of you have any questions, please put them in the chat. In the past, when I've run webinars, if people come on and ask them, then I have to cut that part out. And so it just gets a little, I want to hear your questions and have Pierre answer them. And so I will just read them aloud to her. Does that sound okay with everyone? Yeah, great. All right, let's get started. So Pierre, how important is bone health to overall health and longevity?
Well, it's huge for a lot of reasons. I mean, there's a correlation between how healthy your bones are and how old you're going to live. People who have strong, healthy bones live longer. But not only do they live longer, but you live a healthier old age. You don't want to spend the last 15 years of your life with a broken hip and a broken wrist or feeling weak. And there's one more thing. It's not only your bones, but there's a correlation between your bone health and your overall health. People who have poor bone density or low bone mass also often have associated diseases like diabetes, blood pressure problems, cholesterol problems. There's a lot of associated issues that go along with poor bone mass. So it's a big deal. I can't hear you anymore.
That's because I muted myself.
Oh, okay.
What is the best age to start thinking about bone health?
Well, it's almost getting too late for you and me, and it really should be thinking about it for our kids, for our daughters and our sons. We make bones all the time and we break down all the time. And we actually make more bone than we break down all the way up to about the age of 30. So that's when you really want to think about building the strongest base possible so that you can afford to lose a little bit of bone as you go through menopause and your old age. So you've got to start thinking about this young, but it's never too late to keep thinking about it.
Great, because that was my next question. Is it ever too late to start making lifestyle changes for better bone health? And you already answered it.
You do, well, no, whatever you do now will make a difference. If you change the way you eat, if you change the kind of exercise that you do, it has an impact. Now, it would be better if you started younger, but it's not too late, even if you start at 80.
That's great. That's great to know. When should people start getting bone density scans? Like, what's the best time to get a baseline so that you know what's happening?
Okay, so the Academy of Orthopedic Surgery recommends anybody over 65, men or women over 65. However, if you have any risk factors, you should do it around the age of 50. And I'm going to name you some risk factors because you'll see that most of us have risk factors. If you're a white woman, vitamin D, if it's been low, and most people don't test that. That should be tested when you're a teenager. You'd have to spend 8 hours a day naked in the sun to get enough vitamin D. So a lot of us are low in vitamin D. If you have a family history of osteoporosis, if you have been on steroids for asthma or any reasons, if you've been on long-term antidepressants, that's a huge one, more than 5 years on antidepressants, or on PPIs, proton pump inhibitors, that's associated with lower bone mass, bone loss, on lithium, bone loss. So there's so many associate. If you smoke between the age of 15 and 30, you're at higher risk. So in my practice, I find that most people are at higher risk for osteoporosis. And I'm always so surprised and stunned by how many people with low bone mass that I pick up that thought they were just perfect.
Wow.
Yeah. So most of the time, it's somewhere between 50 and 60. Don't wait.
Okay. Better sooner than later, it sounds like.
And if you've had there are certain fractures like that are typically osteoporotic. If you've had one of those, have your bone density test earlier, even if you're still having your period regularly. And that's the wrist, the distal radius, and if it's a comminuted fracture or the proximal humerus or the proximal tibia, if you had one of those fractures in the metaphyseal portion of the bone, you should really get your bones tested. Or if you have a history of Crohn's disease or ulcerative colitis, go earlier, go 45.
That's really helpful. Thank you. Does it matter which bones get scanned? Is it okay to just look at the average density of all of our bones, or are some bones better indicators of our actual bone density?
Okay, so that's it's a tricky question. All our bones are connected. Your hip bone is connected to your backbone, it's connected to your wrist bone. So if one is bad, they're all not great. So it's one system. And the ones that we have the most data on is for your spine and your hips. Sometimes we cannot do the hips because you've had total hip replacement, so we do the wrist. But again, that data is not as specific and accurate. So it'd be better that we look at your back and your hips. Now, there's another problem. When you get your report, you get a bone density test report, and it gives you a T-score. And that is your bone density compared to somebody that's healthy, that's 25-year-old and has great bones. And but it gives you the average of all the spots that we tested. We test about 20 spots on the hips and 4 different spots on the back. But it gives, when you get the report, it gives you an average. That average number is misleading because you don't break where the bone is strong, you break where the bone is weak. So you have to look at the raw data. And if there's some areas in your hips that show really low bone mass, that's what you have to go on, and that's what you should base your treatment on, not where the average score is. So if you do meet with your doctor, look at the actual report for the raw data, and it is available. You can get that.
Thank you. How do hormonal changes in perimenopause and menopause affect bone density?
Well, for women, it's especially important. Estrogen and testosterone, we actually make testosterone also, and it's important for bone health for us. And if you start having abnormal hormone levels from the time you're young, that means that you're never producing adequate amounts of bones all the way up to menopause. So you're starting behind the 8 ball. So for women who have abnormal cycles, short cycles, or heavy bleeding, or not enough bleeding, or amenorrhea, or they don't start their period until they're 17 or 18 years old, that means that they never produced enough hormones. That is not good. You have to have at least 9 menstrual cycles in a year in order to have enough estrogen and progesterone and testosterone to make good bones. So if you have, and that perimenopausal period, your hormones go haywire. Not only does your personality and your menstrual cycle, but your hormones, and that's what causes it. And those women need to have their bone density tests done younger, and they need to address their hormone problems right away. Women who struggle to get pregnant, I mean, they might have 4 or 5 abortions. They have abnormal hormones. You can't just say, oh, well, that was a problem. I'll give you some hormones while you try to get pregnant. But you have to stay on some kind of hormone program in order to avoid bone loss. So perimenopause and menopause are really important, and especially for those women that start perimenopause. I mean, some women have hot flashes in their late 30s. It's a big deal.
That is a big deal. So I think we're going to have another entire call about that at some point. So that'll be exciting. Thank you for.
We can definitely talk about that for an hour. There's so many details about bioidentical hormones that need to be addressed.
So we can all look forward to that. So how does diet affect bone density? Does it affect bone density?
It does. So the American diet, the typical American diet, is acidic. In the Berkshires, we're pretty good about our diet. Farm to table, we're aware of food. We have the co-op, we have Guidos, that we have good food. Even our regular grocery stores are not like that of down south. So a diet that's really high in vegetables and low in white carbs and meat is a lot more alkaline. And in an alkaline milieu or environment or blood serum, you keep a lot more calcium. So if you eat an acidic diet, you lose calcium. If you eat an acidic diet, you lose calcium and you get kidney stones. And there's actually a correlation between people who get kidney stones and osteoporosis, because there's the same people that are losing too much calcium and are making kidney stones. And diet has a big deal. And we talk about, we can talk about it now, but we talk about when you have kidney stone, you should avoid oxalates, which is on your leafy greens. No, you should avoid the foods that cause a acidic environment. It's a lot more important to avoid the desserts and the sweets and the sugars and the sodas. So your diet is huge for a lot of reasons. I mean, just for your sense of well-being, but your digestions and the ingredients that you get, the nutrients that you get through your gut. Yeah.
So I've heard that maintaining urine alkalinity is important for kidney health. So that means that those strips that measure your pH of your urine actually do mean something, because there's been talk that it doesn't really tell you about what your blood levels are and things like that, but the body works really hard to maintain homeostasis and to keep your blood at a certain pH, right? So urine strips, yay or nay?
Okay, so that's a plus minus, not because the concept is not right. It's because they're not that accurate. But but it's good. I mean, yes. So the way our body stays alkaline is with calcium. Calcium alkalinizes our serum. So if you're losing, so it's kind of a tricky thing. Those strips are just, I mean, they're important, but not accurate enough. You really should measure your 24-hour urine calcium. And when you look at the urine, you look at the pH at the same time. Get a urine test from time to time. But if you're doing it at home is good, just not perfect.
It's sort of a primitive, it's a primitive tool.
It is, but you're thinking along the right lines. It's the right thing. You want your urine to be alkaline it's a representation of what your serum is doing.
And is there, we already went over, is there a way to test?
Well,
is there another way to test for, go ahead.
Sorry. Well, the correlation between, we talked about diet a little bit before, and we should probably go over some of this stuff, but there's a correlation between salt, calcium, and potassium. And the way there's an exchange in the kidneys. And that's what makes your urine acidic or alkalinic, or if you lose calcium or not. They're all interrelated. So if you eat too much salt, you're going to lose too much calcium. The only way our bodies can get rid of excess salt is by grabbing onto a calcium. So if you measure the urine and there's a lot of calcium, that you're losing too much calcium, or you're eating too much salt. So it's another reason why the diet is important, and why it's important to do a 24-hour urine calcium test, and not only look at the calcium, but look at the pH.
Thank you.
And you can follow, people change their diet, and I'll repeat the urine test 3 months later, and there's a huge difference. It makes a huge impact.
Quickly, it sounds like.
Yes.
Because that's not a long time to retest something. So that's very interesting. So can you tell me about how chronic high blood sugar, like we see in insulin resistance and type 2 diabetes, have an effect on bone health?
Yeah, actually, we don't exactly know the mechanism why so many diabetics are osteoporotic, but 50% of them have full-blown osteoporosis. Their bone density test, the T-score, is very low. And for those that the T-score is not osteoporotic, but osteopenic, because none of them are normal after a while. But even if they don't have full osteoporosis, their bones are fragile. They're still not as strong as a normal person, even though so when I see somebody who's diabetic and they have low bone mass, I take it even more seriously than somebody that it doesn't have diabetes. And the reason for that is that they break bones a lot easier and they don't heal as well. But we don't know the exact mechanism as to why diabetics do that. However, diabetes is when you eat sugar and the sugar can't go into the cells, so there's too much sugar in the bloodstream. Sugar is acidic. So we can infer that the reason for it is because they become acidic. Their pH becomes acidic. But yeah.
So, so let's talk about for a second about things that balance that out. So you mentioned vegetables. What about fruits? And what about baking soda? These are all things that are sort of out there
Important.
as ways to do it. So what do you
Yeah,
think about all
that's
that?
that's a good question. So fruits are okay, especially there's some low glycemic index fruits, things like apples and melon. Those are good, but then you have grapes and cherries, not so good. Some of them are a lot sweeter than others. So, but because you're eating that fructose, that sugar with the fiber, it doesn't spike up your insulin, doesn't spike up your sugar as much. It's good. It's still alkalized. It's healthy for you. But fruit juices are not good. Fruit juice is a little bit like alcohol. It's all liquid sugar. By the way, alcohol sucks for a lot of reasons. Alcohol is liquid sugar and it is associated with osteoporosis. Not only that, women who drink 2 glasses of wine a day have a 400 to 800 times increased risk of breast cancer. Now, if that's not enough to scare you to slow down the drinking, it terrifies me. Yeah. So sweets and alcohol and sugars and fruit, okay, but some fruit, and make sure it's with fiber, not in juices. I just told someone one time, I said, yeah, apples are good, especially organic apples, because there's a lot of pesticides, so it's in apples. I said, so she was like, oh, this is great. I'm going to have apples. So she started cooking the apples and making a compote on it and concentrating it and literally making like a syrup out of the apples. I was like, oh, no, that's not the way it works. You got to keep the fiber in there. So that's as far. And another thing that's really bad for bones is sodas. Don't drink any soda. Soda, in order to make it bubbly, they literally put acid in there, either phosphoric acid in there to make it bubbly. It's acidic. It's not good for you. Especially dark sodas like Coca-Colas and stuff like that are horrible. But sometimes I go to the grocery store, I see people load up with full carts of sodas. Seltzer water is not quite as bad, but still not great. But as a treat, put a seltzer water and a glass of wine instead of wine. It's good. And you asked me about potassium bicarb. Potassium bicarb is one of the best ways to alkalinize your bloodstream and your urine. It works, and it's really good for your bones. It's really good for people who have high urine calcium output or people who have kidney stones. The problem is it doesn't taste very good. The way you put it together is a quarter teaspoon of potassium bicarb in a big bike bottle, 20-ounce bottle of water, and sip on that throughout the day, 1 bottle or 2. If you put more, I had a patient I saw today, and she goes, I tried it. I put a teaspoon in there. She goes, it was terrible. So then I switched to half a teaspoon. It was still terrible. I'm like, yeah, the instructions are a quarter. I'm telling you, they don't taste good, and then you won't keep doing it. But that's a great way of alkalinizing your bloodstream. So if you had too much dessert or something and you're feeling guilty, have a little extra potassium bicarb. They also make a supplement of potassium bicarb. You can have that. It's not quite as good as sipping on something all day long, but it's also very good, and they've shown really good data with that. What we use potassium bicarb for is to alkalinize your hot tub. So I buy a big bag about this big on Amazon for like $8. It's not a complicated thing. Do not buy sodium bicarb, because sodium bicarb has the salt in it. So no, buy the potassium bicarb. So yeah. Another thing you can do, and they don't know why this works, but it does, is squeezing a half a lemon in a tall glass of water even though that's acidic, there's a process that happens in your gut and it turns alkaline and it turns your urine alkaline. Weird process, but it also reduces your calcium output. Don't put the lemon though with the potassium bicarb because they'll work against each other in the bottle.
That's very interesting, guys. I just saw that question come through the chat. So I will get to everybody's questions, I promise, but somebody just asked that question. So you read their minds. How does exercise affect bone density?
Ooh, that's a sensitive topic. So I love exercise. I exercise a lot. I went biking Saturday and Sunday, 20 miles. I mean, it's really important for a lot of reasons, both your mental health, your physical health, your strength, your balance. Um, and as we get older, we have to do more and more balancing exercises, simple things like getting on the floor and getting up. I mean, I realized I was getting weaker. I've got a little arthritis in a lot of arthritis in one of my knees. And I realized I was struggling to get up. So I started doing more and more. I literally do 20 twice a day, just getting on the floor and getting back up, getting on the floor, getting back up without using my hands or the furniture or going on all fours. And that really helps with balance because in order to break a bone, two things have to happen. One, you have to have bad bones, or but you have to fall. So even if you have bad bones, but you don't fall, you won't break a bone. So the stronger you are, the better. So for that reason alone, it's important for us to avoid significant fractures. But the trick is after menopause, once you don't have any estrogen anymore, you're not producing a lot of estrogen and testosterone, you don't rebuild your bone mass with exercise. A lot of people think, oh, I'm just going to do yoga. I know I saw a study that you can do yoga and you can rebuild your bones. It doesn't work that way. You literally, it might slow down the deterioration of the bone, but it doesn't rebuild it. And that study that came out about yoga and exercise some time ago, about 10 years, 15 years ago, they were just looking at the spine. And again, they were looking at the average score, not the specific spot. But the spine, as we get older, is not a good indication of our bone mass. And a lot of people, because a lot of people start getting arthritis. And arthritis makes these little bone spurs, and that gives you a false reading. It makes you look like your bones are more healthy or healthier than they are or stronger than they are. So you have to be really careful about it. And that study was looking at the bone mass of spine over 10 years in women who are 50. So of course the back is going to look a little bit better because most people by the time they're 60 or 70, they've got arthritis in their back. So just don't count. My point is, don't count on exercise alone to rebuild your bones.
What about strength training? Any difference there between that and yoga?
No, that's strength training too. Both of those are strength training. Okay. Yeah, they're both good for strength. I mean, and balance. But I'm sorry, but I'm 60 years old, and there's some positions, that down dog and all that stuff. Sometimes it's getting harder.
And you're an athlete, so that's saying something. And knowing our own limits is a part of being healthy, right? So
yeah, absolutely. And having fun. It's not fun anymore. Some of those poses in yoga are just not fun anymore.
Are there any supplements you think are super important for bone health? Obviously, under the supervision of one's own physician. Pierre is not giving anyone any medical advice on this webinar, just to be clear.
All right, thanks. Okay, so there are so many supplements for bones, and most of them have some effect. But when I start treating someone for osteoporosis or just osteopenia or to bone health, there are 5 or 6 supplements that are mandatory. They're my baseline stuff. Now you could add more to it, and that's fine, but you got to include those 5 or 6. Number 1 is your vitamin D. That is huge. Vitamin D increases the Actually, vitamin D is so important. We've decided in the medical community that it is not a vitamin, it is a hormone, because we have receptors all over our bodies, in the kidneys, in the skin, in the gut. We have receptors for vitamin D. So that classifies it as a hormone. That's how important it is. And most people that I test are low in vitamin D. The sad thing is, the testing, when you get a blood test, the range is huge. It's 30 to 100. That's a huge range. And doctors will test it and they'll say, oh, they'll see, oh, you're 31. That's normal. 31 is not normal. The range you want to be in is around 60, somewhere between 50 and 60. I like 60 a little bit better. And that usually requires a higher dose of vitamin D and higher than the regular recommended dose, and higher than when you get your multivitamin or your combination calcium vitamin D, because you can get those as a combination, and that usually there isn't enough vitamin D in that. So vitamin D is huge. The next one is a little bit of calcium. Now, if you eat a healthy diet and you don't have any gut issues, you don't need a lot of calcium. Calcium is in everything that we eat that was ever alive. So any meat, any fish, any vegetable, fruit, that has calcium in it. So if your digestion's decent, you're getting a good amount of calcium. So that one's not as important. It's more important that we help the absorption of the calcium. The next thing that helps you absorb calcium and put the calcium in your bones is vitamin K2. We don't talk about vitamin K2 enough, and it's really important, especially for people who bruise easily. Some women know from the time they were kids, they'd wake up in the morning and they have a bruise. They don't know why. They have a chronically low vitamin K2. Those people often have GI issue, also IBS and stuff like that. But vitamin K2 is another, so we've got vitamin D, calcium, vitamin K2, magnesium. Now, a lot of people take the magnesium with calcium. The problem is calcium keeps you up a little bit, so you should take that in the morning. And magnesium relaxes your muscles and puts you to sleep. So you really take it in combination. It's not very good. You really should take your magnesium at bedtime, both for your bones, for sleep, muscle relaxation, and for cramps. I mean, that's just important at bedtime. The next one is probiotics. Probiotics for anybody who's got GI issues, and people with IBS or gluten intolerance, they all have low bone mass because they're not absorbing the nutrients like they should. So probiotics for them is especially important. Not everybody needs probiotics. Another one is collagen. Collagen is good for your skin, your bones, your digestion. Collagen is important too. Those are my basic startup ones. I will modify what I give patients, and I might add more according to because I do some blood testing, I do some urine testing, according to what I find. But we also talked about the potassium bicarb. If you don't want to take it as a liquid, you must add it as a supplement.
Got it. Great.
That's already a lot of supplements, though. I don't give the rest of them. It's just too many. It's overwhelming.
Yeah, I understand that. And in terms of magnesium, are some forms of magnesium, some things that magnesium is bound to when you take it better than others, or is it kind of an equal playing field in terms of magnesium?
So magnesium is well absorbed almost in any form. The problem is the most available form is magnesium citrate, but that can give you a little diarrhea. It can cause a little bloating. And if you got IBS symptoms, stay away from magnesium citrate. You would be better with magnesium biglycinate or magnesium malate. There's also a trimag, which is a combination of 3 different magnesium that really helps with sleep. So it depends what your GI is like. Now, some people have a history of constipation. They need the magnesium citrate. So it depends where you are.
Thank you. So this is, I mostly target women with my talks, but most of us have a man in our life in one way or another, be it a relative, a friend, or a significant other. Do men have to worry about osteopenia and osteoporosis, or is it just women?
They have to worry about it even more than we do sometimes. Now, the rate of men with osteoporosis is less than for women. We have it more. And our bone mass is smaller to start, so we break bones easier. However, if a man is diagnosed with osteoporosis, let's say he breaks a hip, 1 in 3 will die within a year. So men don't do well with osteoporosis. By the time their bones mass is low, they've got a lot of other medical issues that are associated with it, and they don't do well with broken bones. So they do have to worry about it. And a lot of men have, Crohn's disease, ulcerative colitis, digestive issues, or smokers. Definitely you have to address it for men as well as women. We usually don't do a bone density test I mean, I do bone density tests usually around 50 for women. Men, I usually wait till they're about 65. But talking about men, though, sometimes relationships can be quite stressful. Stress adds to osteoporosis and bone loss. So fix your man's osteoporosis, but fix any kind of relationships that may be causing stress.
As a general rule, just bringing down
Yeah.
the stress is definitely a good thing. So we have a question, is grass-fed beef okay? Because you were talking about the acidity. So we're going back in the conversation now because
Are we
I'm
going
going
back
back
to
in the chat.
questions now?
Yeah,
Or
we're
chat room
going.
questions?
Yep.
Okay, great. Okay, so beef is okay. It's just, I don't know if you remember, but when I was growing up, it was meat and potatoes. We had a T-bone that was like this big, and we had a potato. I don't think I ever saw vegetables growing up. Um, and so it's the proportion that matters. As we get older, we even need more protein. So grass-fed beef is great. Protein is important for us, just not in the quantity that sometimes I see on people's plates. And uh, compensate, put a lot of vegetables with it and forget the potato, so that
Mhm.
you can balance any kind of acidity in the protein. But meat's fine.
Thank you. Um, we had the question, what are the best sources of calcium? But I think you went over the fact that it's in everything. It's in meat, it's in fish, it's in vegetables, it's in fruits, it's in most foods. Do you have anything you want to add to that?
My main thing is you have to, it's not so much that we're not getting enough calcium as we're not absorbing enough calcium. So if get your vitamin D up, take your vitamin K. K is interesting. What vitamin K does, it's like an usher. So you go to the big theater and they give you a ticket with a seat. You have no idea where to sit. So literally, the vitamin K grabs the person or the calcium and puts it into the bones, into their seat, and pulls it away from the heart. So, matter of fact, we're talking about men. A lot of anybody that's on vitamin D and has heart issues, and a lot of men do, women too, but I see more men with major heart issues. You have to take vitamin K because it pulls the calcium out of the circulation and puts it into the bone. So it pulls it away from the heart or the vessels or the kidneys. So that's important.
And now we have a question. How much sodium is okay?
Yeah. Okay. So not a lot. The dose, it used to be like 2,000 milligrams a day was okay. It really isn't. They've lowered the daily requirement to 1,200 milligrams. That's still a lot. Even you should never add salt at the table. So I've replaced that with, I use cayenne pepper, cumin, curry. I try to do other kinds of sauces, spices to my food to compensate for the salt. Because let me tell you, salt makes food taste good. And you get used to it. And the more stressed you are, and as you go through menopause, the more salt you will crave. So
Hmm.
be aware of that. And you kind of get salt in the air, you get salt in any food that you buy, any bread that you buy, and a can of tomato and chicken broth. Everything has some salt in it, so don't add salt. Salt is really bad for bones. I mean, it's really bad. It's almost up there with smoking and low
Hmm.
vitamin D. It's
Hmm.
that bad. And yeah, and Himalayan salt, yes, it's not as concentrated as your regular table salt, but it's still salt. Not good.
So we have a question about using replacement hormones after menopause. So I don't know if you want to touch on that here, knowing that, we're making a plan to do a longer chat about it later.
Yeah, I mean, that's one of the things that I use to treat bones. It's not as powerful as some other agents, but most women who have low bone mass young also have a lot of perimenopausal and menopausal issues, and that it helps both their bones and their mental state, and their relationships and a lot of other things. But that is definitely a very good options, bioidentical hormones to add to in the treatment of osteoporosis.
We have the question, are prunes good for bones?
Yeah,
How much vitamin D per day?
Everybody's a little different. Some people absorb it a lot better. Black people, black skinned people don't absorb it as well. Dark skinned people don't absorb as well. So they usually need more. There's a higher rate of low vitamin D in dark skinned people. The recommended dose, I think, is now 1200. Is it 1200, 1400? Anyway, still too low. Most of my patients end up somewhere between 2,000 and 5,000. I have some patients all the way up to 10,000, but I check their vitamin D level. There's really no reported cases of vitamin D overdose. You'd have to take 10,000 units a day for a month in order to see a slight rise in your serum calcium, which is, it's almost impossible to overdose on vitamin D. But I usually test to make sure they stay in that range, and I like people around 60 on their blood serum levels.
So it sounds like testing and just kind of being aware of ourselves and with our physicians is kind of an important part of getting, past 25, is that we need to check and make sure that we have what we need going forward in order to have healthy bones, and that testing is a part of that.
It's huge. I'll tell you a story. I saw this woman in my office that I knew when she was a child. She was so bubbly and so fun when she was a kid. And when I saw her in my office, she came in with a broken bone. And she was about 35. And she comes in with a hood on her face and big circles under her eyes. And she's a different person. And I'm talking to her. I'm like, what's going on? But because she broke a bone, I decided, and the way she broke it, and a metaphyseal bone we were talking about, even though she's only 35, I said, you know what? I need to check your vitamin D and treat you. Her vitamin D level was 13. Whoa. So I started on a really high dose vitamin D. I didn't see her right away. I ended up seeing her sister about 4 or 5 weeks later. Her sister comes in, she goes, what'd you do to my sister? I'm like, what do you mean? She goes, she's a different person. She's been struggling with depression for the last 15 years. She's been on 5, 6 different antidepressants. None of them would work. And now she's off all her medication and she's happy as can be. The low vitamin D level is associated with depression, especially in young people, especially nowadays. They spend a lot more time learning on their computer, working on their computer, not as much outside as they used to. If you see a kid 15 to 25, 30 that's somewhat depressed, treat them with vitamin D before you start an antidepressant. It has that strong of an effect. Vitamin D is huge. And even my cat here is agreeing.
That's amazing.
Yeah.
So we've got now the question, how about strontium?
Strontium's good. That's one of those extra things that I sometimes, people are on. It's good for their bones. It doesn't replace the basic ones that I gave you earlier, but it's a good one.
When is it ideal to take potassium bicarb if you are also taking lemons daily? Should one drink lemon water in the morning, for instance, and potassium bicarb in the afternoon?
Exactly. You nailed it.
Okay. It wasn't me. It was in the chat, but yes.
Yeah, no, it's right. You just sip on the bottle throughout the day, or take it, at bedtime, your potassium bicarb. Mm-hmm.
Yeah, we have someone saying in the chat, I can echo that. I had low vitamin D and probably still too low. But she really felt like she was dying. Like it felt that.
Yes.
It felt really dire. So
I'm so glad to hear you say that.
Yeah.
Or read you say that.
Yes, indeed. All right. Well, that is all the questions in the chat. Does anyone
Those are great questions, by the way.
Yes. Yeah, we've got definitely some great questions in the chat. I think I got all of them, but I'm just going to do a quick double check. Yep. Because there were a few that more than one person asked. So everybody was on the same page in the chat tonight. Well, thank you all so much for coming. And Dr. Boutin, thank you. Thank you so much for taking the time to share your wisdom with us. And I look forward to chatting next time.
All right. You're welcome. Have a good night.
Good night, everyone.
Thank you. Thank you.